As discussed in the previous slide, a lot of the elderly in Whittier, California at the senior center were fearful of falling. There were several reasons that they feared falling, but primarily was because it could be very detrimental to them and their health. A lot of controversial topics have been identified based on the falling of elderly individuals. For example, Medicare only covers the first 100 days in a convalescent home. This can be very detrimental to an individual because if they need more days, they're responsible financially for being in the convalescent home. Also, a lot of elderly people who fall can actually benefit from the physical therapy given in convalescent homes. However, they cannot afford it. The problem is that when they are home, there's no program for them to prevent falls or to help them recover if they've had a fall. The reason for this is because they may not qualify for home care. And because they can't qualify for home care, this actually puts them at risk to be put into a long-term care facility. Home care is a great option because it prevents falls and it can also help them recover if they've had a minor fall. However, not everyone in the elderly population actually qualifies for home care. Some innovative topics are fall prevention programs in the community and ones that can also be done at home. So previously we discussed the workout class that is actually offered at the senior center, and this helps with balance and coordination to prevent falls, but this is done in the senior center. There's also an article called A Social Virtual Reality Based Application for the Physical and Cognitive Training of the Elderly at Home. This is a new study that discusses a virtual experience on a bike that the elderly can actually do that will actually help them be cognitively trained and physically trained to prevent falls. This is a great option because if they do not qualify for home care, this can be a great preventative of falls so that they won't have to go to a long-term care facility. Arlotti et al. States, previous studies demonstrated that fall prevention programs are effective, but they suffer from low adherence, especially when subjects have to train unsupervised in their homes. To try to improve treatment adherence, virtual reality and social media have been proposed as promising strategies for the increase of users' motivation and thus their willingness to practice. This is a great option because, like I stated before, at the senior center, they were actually showing seniors how to be more compliant with using electronics and technology, and this can actually motivate them to adhere to a fall prevention program at home and will also give them the independence that they are seeking.